Hello students, welcome to the Academia. Today I will discuss the process of upper GI tract endoscopy. Now what is endoscopy? It is a procedure involves inserting a long flexible tube which is called endoscope down the throat and into the esophagus. So how long does the upper endoscopy procedure usually take? It takes between 15 and to 30 minutes. The endoscope doesn't interfere with the breathing and many people fall actually asleep during the process. So why the endoscopy have done? It helps to evaluate the persistent upper abdominal pain, nausea, vomiting, bleeding, difficulty in swallowing. It can detect inflammation, infection, tumors and ulcers. Before the endoscopy procedure, the IV pain medications and sedatives are used. Blood pressure, pulse and oxygen is monitored. Local anesthesia is given and asked to lie the patient on the left side, and also the supportive mouthpiece is given. Upper GI endoscopy or EGD is a procedure to diagnose and treat the problems in the upper GI tract, and it includes the food pipe, that is esophagus, stomach and the first part of the small intestine, that is duodenum. So these basic parts are included in the upper GI endoscopy. This procedure is done using a long flexible tube called endoscope. The tube has a tiny light and a video camera on one end. The tube is put into the mouth and throat. Then it is slowly pushed through the esophagus and the stomach and the duodenum. Small tools may also inserted to the endoscope so that they take the tissue sample for a biopsy. So in the video we can see this. Remove the things such as food that may be stuck in the upper GI tract. Inject air or fluid. Stop bleeding. So these things are done. Now, what are the contraindications of upper GI endoscopy? Number 1, suspected or known perforation. Next, ingestion of caustic materials. Known or suspected coagulopathy. Patient in shock. Uncooperative patient and inadequately trained personnel. So these contraindications are there. Now, why do I need an endoscopy? What is the answer? Endoscopy allows the doctor to visually examine the organ without having to make a large incision. A screen in the operating room lets the doctor see exactly what the endoscope sees. So these are typically used to help the doctor determine the cause of any abnormal symptoms you have, remove a small sample of tissue which can then be sent to a lab for further testing like biopsy, help the doctor to see inside the body during a surgical procedure such as repairing a stomach ulcer or removing gallstones, tumors, etc. So there are a lot of advantages of endoscopy. Generally, when a doctor prescribes endoscopy, in certain conditions like inflammatory bowel diseases, IBD, or stomach ulcer, chronic constipation, pancreatitis, gallstones, unexplained bleeding in the digestive tract, tumors, infections, blockages of the esophagus, unusual vaginal bleeding, then blood in the urine and other many digestive tract issues. So these are the variety of symptoms which are after reviewing a patient, the doctor go for the endoscopy so that the ultimate diagnosis can be done. So in this video, just I have shown the introduction about the upper GI tract endoscopy. Now later in other videos we move to the detailed discussion about the endoscopy. If you have any query or question, you can ask or can comment in the comment box. Thank you.